Thank you for choosing Agnesian Center for Bone and Joint Health for your joint replacement. We want to take this time to present you with some information that you will find important to know prior to your surgery. I'd like to discuss the anatomy of the hip joint with you. The hip joint is comprised of the ball attached to the thigh bone, the femur, and the socket. When we are doing a hip replacement surgery, they're replacing the socket, the ball, and part of the metal does go into the femur to help stabilize your joint. You may have some mobility restrictions after surgery. This will specifically be discussed with you by your surgeon and in the PASS clinic. To prepare for surgery, we will do some necessary blood work and additional testing that your surgeon has ordered. We will give you instructions not to eat or drink after midnight, the night prior to surgery. This does include no ice chips, water, gum, candy, nothing after midnight. You will be having an appointment in our pre-admission surgical services department called the PASS clinic. The PASS clinic nurse will give you instructions regarding if there are any medications that you should take on the day of surgery, medications to stop prior to surgery. Discuss any herbal supplements or nutritional supplements that you are taking with your physician. Some of them may need to be stopped ahead of time. You will also be given instructions not to shave your legs or cut your toenails for 1 week prior to surgery to prevent any chance of infection. You will be given a binder from the physician's office. In the binder, there is a list of things that you may want to bring with you. We recommend shoes that have good soles, are comfortable, and easy to get off and on. If you prefer sandals, they do need to have a back strap to them. If you normally wear dentures, glasses, hearing aids, we do want them here, but bring cases to put them in. We recommend 3 extra sets of clothing, especially loose, comfortable clothing such as shorts, pajama pants, or sweatpants. We do not want anything with tight elastic on the bottom. Bring your normal personal care items. We also encourage you to bring a list of your current medications along, including any herbs or supplements that you take. We ask that you bring any breathing devices that you may own along with you, such as a CPAP machine. If you own a walker or crutches, please also bring those along. They do not have to be brought in on the day of surgery. A family member can bring your walker or crutches in at a later date. This way our therapy staff will adjust the height and make sure that your walker or crutches are a good fit for you. If you do not own a walker or crutches, this will be discussed in your PASS clinic visit appointment, and one will be ordered for you. You will be provided with a binder from the physician's office. We ask that you bring your joint replacement binder along with you on the day of surgery. You will also be given a breathing device in the PASS clinic that we ask you to also bring back with you. On the day of surgery, we recommend not to bring any valuables with you and also not to have toenail polish on your toes. On the day of surgery, it will take 2 hours to get ready for surgery. The surgery itself is 2 to 3 hours. You will go to the recovery room for 1 to 2 hours after surgery to be monitored very closely. During surgery, your family does wait in the surgical waiting room. There are also pagers that are available for your family members to take so that they may get a cup of coffee and wander around the hospital. They do not have to stay in the waiting room the entire time. After you are finished in the recovery room, you will be going to the 6th floor, the orthopedic unit. The nurse that's taking care of you will take everything that you bring and deliver it to your room. You will meet the anesthesiologist on the morning of surgery. They will do what we call pain control measures. This means that they will give you pain medication before the surgery starts so that when you wake up after surgery, the pain medication will be working and you will be comfortable. there are various options of pain control that are available to you. One option are oral pain pills. You may be given a pain pill with a small sip of water right before surgery. Another option is IV pain medication. You may have a peripheral nerve block where they inject medication into your surgical leg to block the nerves in that leg. This does not get rid of your pain altogether. It cuts your pain in half of what you would have without the block, and then you get additional IV and oral pain medication also. Another option for pain control is medication injected into your spine. There is reading material available in your binder regarding these pain control measures. On the day of surgery, you may have a urinary catheter put in to drain your bladder. This would be put in during surgery. You will have IV fluids for hydration and to administer medications. You will have special stockings to help prevent blood clots. Physical therapy will get you up and moving already that same day of surgery. You may sit up at the side of the bed, you may stand, you may even walk. You will start on a blood thinner on the evening of surgery as a preventative measure against blood clots. You will also have oxygen overnight. The nursing staff will do hourly rounding. They check on you every hour during the day and every 2 hours during the night to make sure that your needs are met, that you're safe, and that your pain is well controlled. You can let the nurse know if there is a time period that you would like to rest and not be bothered. The day after surgery, you will be experiencing some pain and discomfort, but the nursing staff, doctor, and anesthesiologist will work together to make sure that you are as comfortable as possible. The day after surgery, you will be able to get up to a commode at the side of the bed and then eventually to the bathroom with the help of the nursing staff. Physical therapy will start the day after surgery. This is twice a day. Occupational therapy will also start the day after surgery. Their job is to help you get washed up and dressed using special equipment if necessary. Eventually, you will go to a gym down the hall on the 6th floor for your physical therapy. They will teach you how to get in and out of a car. They will practice steps, and they will also have you doing progressive walking and exercises. They're going to want you to participate in your physical therapy and occupational therapy on a daily basis. We ask that you drink plenty of fluids and eat a well-balanced diet so that you heal well. You will be given pain medication, and we recommend taking your pain medication routinely to make sure that you are comfortable. You will also be given a breathing device to use after surgery to help prevent pneumonia. Medications that you will be given after surgery include blood thinners, antibiotics, pain medication, and we also start you on a bowel program to help prevent constipation. You will be given medication, and you will be initially on a liquid diet to help prevent any complications. You will need to let your dentist and doctors know that you've had your joint replaced. The purpose of this is to prevent any chance of an infection from heading to your joint. They will have you take antibiotics prior to any invasive procedures, such as dental procedures, colonoscopies, and surgeries. Every surgeon is specific on how long you need to stay on antibiotics for. Sometimes it's for several years, and your surgeon will let you know when you can stop. This is not an antibiotic to take on a daily basis. It is just prior to any invasive procedure. You will be given an identification card saying that you've had your joint replaced. You are more at risk of developing a blood clot after any surgery. What we talk about next is not meant to scare you. It is meant to make you aware of symptoms to watch for so that you would be more apt to get treatment sooner. You're at risk of developing a blood clot because you are not as active after surgery. Also, the process of healing involves clotting. The first complication for a blood clot is called a deep vein thrombosis. This is a blood clot that forms in the deep veins of the leg. They can be in different areas of the leg, such as the groin, The majority of times a blood clot will be in the calf area. Sometimes people have all of these symptoms, sometimes they just have one or two. So if you are in doubt, please call the doctor's office to get it checked out to be on the safe side. Symptoms would include very sore, swelling calf muscles. It may feel hard and firm where a clot is. Your leg may look reddened compared to your other leg, and it may feel warm to the touch also. If a blood clot travels to the lungs, that is called a pulmonary embolism. Symptoms of this include sudden chest pain and shortness of breath. We do a lot to help prevent blood clots so that your chance of developing one is lessened. You will be up and moving already on the day of surgery to help decrease your chance of developing a clot. They will have you doing exercises on a regular basis to help prevent blood clots. You will be given special stockings to wear after surgery, also as a preventative measure. On the evening of surgery, you will be started on a medication for the prevention of blood clots. The medication is called Coumadin or warfarin. Coumadin is the brand name and warfarin is the generic name, and you will hear those two names interchangeably. You will be taking Coumadin for 4 to 6 weeks after surgery. After this 4 to 6 week time frame, your activity level will be improved and your chance of developing a blood clot will be lessened. The medication does take 4 to 7 days to start working, so they will be monitoring your blood count very frequently so that they know when the medication starts to work. What is Coumadin? It is a medication that makes your blood take longer to clot. You take it at the same time every day so that your blood levels stay consistent. Usually it is taken in the evening, it is well tolerated, and it may be taken with or without food. Your doses change a lot based on what your blood count is, so keep track of what doses you take every day. If you miss a dose, take it as soon as possible, but we do not want you to double dose without checking with your doctor first. You will know when the warfarin is working by a blood test that they take called an INR. Normally, if someone is not on a blood thinner, your INR is about a 1. After surgery, the goal range is to keep your INR at 2 to 2.5 to help prevent blood clots. The higher this number is, the more likely you are to bleed. The lower it is, the more likely you are to clot. So this 2 to 2.5 is the goal range after surgery. As I mentioned before, warfarin is very well tolerated. The most common side effects have to do with bleeding. You will notice that you will bruise very easily. You may feel colder than normal because your blood is thinner. You also may notice bleeding from your gums after brushing your teeth. Contact your physician if you notice any of the following. If you have a headache, dizziness, weakness, persistent nosebleeds, a cut that does not want to stop bleeding, blood in the stool or urine. Any medication that you take in combination with the warfarin will make your blood a little bit thicker or a little bit thinner. You will be on your normal medications while you are here in the hospital. You do want to check with your doctor or pharmacist before beginning or stopping any medication while you're on the Coumadin. By starting or stopping this medication, it can throw your INR blood count out of whack. After surgery, you will be on narcotic pain medication. Eventually, you will not need strong medication, and you will decide to take something over the counter. In that circumstance, we would need you to stick with Tylenol or the generic acetaminophen. So after surgery, no Aleve, which is naproxen, no Motrin or Advil, which is ibuprofen, and no aspirin unless your doctor says otherwise. The bottom medications can thin your blood. We do not want you on a blood thinner in addition to a blood thinner. In the binder that you have received, you will have a list of foods that are high in vitamin K. Vitamin K makes your blood clot. The rule of thumb for the majority of those foods are the leafy green vegetables. We would like you to eat those foods consistently and in moderation. If you're used to eating a salad every day, you may continue to do so. What they do not want you to do is fluctuate. Eat a salad one day and then nothing for the next 3 days. That is when your INR will vary. Alcohol can increase your bleeding risk. You do want to check with your physician regarding consumption of alcohol while on Coumadin. The expected length of stay in the hospital is 3 to 4 days, including the day of surgery. You will be meeting with the care manager in the PASS clinic, and they will help you decide what the best options for you to go home would be. They are looking for you to be able to safely walk on your own, be able to get dressed on your own, go to the bathroom, and have meals available to eat for you to safely return home. We do want you to make modifications to your home to make sure that it is safe for you to return home, and the care manager will help discuss those modifications. Thank you for choosing Agnesian HealthCare for your joint replacement. We look forward to helping you receive optimal results.